Health encompasses so much. There's your physical and emotional health, but also your mental health. That's why today on 10 News at 5, we are dedicating a half hour to information you may find useful on your own mental health journey. From access in our rural communities to how artificial intelligence is replacing therapy for some, to illness and how a diagnosis can impact you and your loved ones. Join us as we explore different areas of mental health and how it intertwines with your everyday life. That and more on 10 News at 5.
Ten News on WBIR starts now.
Good evening, everyone. Thank you for joining us for our mental health special. I'm Robin Wilhoit. Healthcare is a necessity, but in some areas it's just not accessible. That is why the Mental Health Association of East Tennessee is working to bring new programs to our region. 10 News reporter Emily Crabtree explains how they are reaching rural communities.
What we've discovered is residents of rural communities around Knoxville are even more predisposed to not being able to access care.
The Mental Health Association of East Tennessee is making sure no one goes unnoticed, especially people in rural areas.
We know folks in rural communities, they're just like Knoxville. They might need mental health care. They might not be able to afford it. They might not be able to find it. They may not have insurance. All those things are barriers. So let's sweep those barriers away.
According to the association, rural neighbors make 26% less money than those in Knox County. They also face a 50% higher rate of being uninsured, and they're 10 times less likely to have access to mental health care nearby. That's where the new Rural Community Access Bank steps in. It partners with therapists to bring care directly to those in need, no matter their income.
We've had, probably 50 plus. And I'm probably underestimating.
Donna Mitchell is one of the therapists working with the program. She grew up in the Claxton community of Anderson County and knows the challenges of rural life firsthand. She says one of the most important things to remember is that a person's background does not define them, and it's okay to ask for help.
That says so much, even if the cultures are the same or they're different. It's just that you can be a listening ear and a kind guide.
And that was Emily Crabtree reporting. If you or someone you know needs help, reach out to the Mental Health Association or call 988. Over the last decade, the number of young people experiencing depression-like symptoms has grown. The Centers for Disease Control reports almost 40% of high schoolers say they feel sad or hopeless. A nonprofit is working to change that, though, with a different approach. A crisis hotline for teens run by teens. Here's NBC's Camilla Bernal with more.
Hi, this is Teen Line. What's your name?
It's a call, a text, or an email without judgment.
I'm going to use that one right there. Yeah.
Where teenagers are on both ends of the line.
Talking to a teen, especially an anonymous teen, we're not going to try to solve your problems. We're going to mainly empathize and hear you out.
Brooke is 16. She's a volunteer in Los Angeles at Teen Line, a hotline for teenagers in crisis across the world. And reach outs have been on the rise.
Yeah, I have a couple resources for them.
This year alone, they're expected to connect with over 10,000 teens.
A lot of people, when they hear Teen Line or hotline, they think, oh, suicide call, crisis call. But so many of my calls have been about relationship issues, school stress, anxiety, maybe a fight with their parents.
Oftentimes, she can relate.
For a lot of teens, I know that they had a hard time during the pandemic, which is also what drew me to Teen Line. So I thought that if there's some way that I could help teens not feel that way, then I want to do it.
And it's working.
89% of the youth that call or text or email us have said that they feel better at the end of the call.
Lynn Morris is the CEO of Didi Hirsch Mental Health Services, which runs Teen Line. It's available for any teenager in the world from 6 to 10 p.m. Pacific time.
If we can get to kids before a major crisis happens and get them talking and learning how to reach out for support when they need it, the better off they'll be in the long term as well.
Teen Line's increasing number of reach outs coming at the same time government spending cuts and policy changes have impacted other mental health services. But here, private donations allow for about a dozen of the more than 100 high school volunteers to shuffle in for their shift. They're always supervised by adults.
You definitely create and establish coping skills that help you leave it here and not bring it home with you.
They all go through a thorough selection process and 65 hours of training.
It can be exhausting, but in one of the most rewarding ways, because you just know that you've put your energy and your time towards something that really matters and that's made an impact.
A chance to grow while saving lives.
Being able to listen to someone and empathize with them and not try to fix their problems is like, you know, all I can do, and like it makes being on the line so worth it.
Back in May, we told you about a peer-led organization that's helping students navigate their emotional and mental health while in college. Sources of Strength has a chapter at the University of Tennessee, and it's looking to grow. The president of that group told us it's easier for many college students to discuss their challenges with someone who's going through the same thing.
There's a bunch of reasons why your peers can really help support you on a mental health level. One, they can be people you relate more to. Two, they are closer to you in life. You know, we're all 18 to 22, or a little older, younger, plus or minus. But we're all kind of at the same point of life. We're in college, we are experiencing the same testing struggles, same, university struggles.
Members of that group are trained to communicate and listen to students. You'll learn more about Contact Caroline coming up in just a few minutes. We have a list of mental health resources available right here in East Tennessee on our website, WBIR.com. From the Mental Health Association of East Tennessee to the McNabb Center, just scan the QR code you see right there on your screen. Well, a cancer diagnosis is never easy, but experts here in East Tennessee are working to make them more manageable. After the break, we will introduce you to the CARE program and how it can help you and your loved ones navigate that disease. And then later in our technology-filled world, more people are turning to artificial intelligence to discuss their mental health. At 5:49, why this could cause more harm than good.
10 News on WBIR starts now.
A cancer diagnosis can turn someone's entire world upside down. UT Medical Center, though, is stepping in to offer the tools and support needed to cope through its CARE program. Experts help patients work through their feelings, including loneliness and isolation. The team at UT, they listen and they help patients set goals for themselves.
Most commonly, probably what I hear from patients is, I want to get through my treatments. You know, that's their goal, is to make it through the hardest of the treatments and be able to cope.
The program typically runs 4 to 6 sessions. You can hear more about this program on 10 News Today, coming up next Monday in our Mental Health Monday segment and online at WBIR.com. As always, if you or someone you know is going through a difficult diagnosis like breast cancer, support is available. The cancer community of East Tennessee, it offers programming for patients in treatment and for survivors and their families. Breast Connect, that's another nonprofit that was started by survivors to show people going through treatment that they are not alone. We will have more in those groups coming up as well. And next, the story of a woman who was 33 weeks pregnant when her doctors broke the news she has cancer. Still to come, her journey through that diagnosis and how she's now supporting other young moms diagnosed with that disease.
Ten News on WBIR starts now.
Thing, but there was never like this dramatic moment where somebody sits me down and says, you have cancer, you know?
Well, a cancer diagnosis is mentally, physically, and emotionally draining. For a mom in Knoxville, that diagnosis came when she was 8 months pregnant. 10 News anchor John Becker and producer Lexi Martin share her story and why experts say support is key for young women facing that same battle.
The word cancer carries serious weight. Fear, sadness, anger, sometimes even hopelessness. For Rachel Strange, all of those emotions hit at once. She was 33 weeks pregnant when she was diagnosed with breast cancer.
The doctor, the radiologist, and a nurse took me into a separate little room, and they actually were both crying in that room. And so it was kind of one of those moments where it's like, okay, this is serious.
Rachel's focus had to shift from the joy of bringing her daughter into the world to fighting for her own life.
Is she going to be okay? Am I going to be okay? Am I going to be here to see her grow up?
Her world turned upside down, but she didn't face it alone. Her mother moved in, supporting both her and the baby, helping them regain a sense of routine. That structure became a lifeline for Rachel's mental health. It's part of cancer care that often gets overlooked: emotional support.
I think a lot of times, understandably, loved ones want to fix things, want to solve problems, want to be really helpful, when sometimes the person who's struggling just wants to be heard.
That expert says mental health needs to shift daily. The best support: be present, be patient, be flexible.
Everybody needs support, right? A cancer diagnosis is really challenging. And I would say even family members or friends, we say where I work at the cancer support community, cancer physically impacts one person, but it really affects everybody who loves them.
Therapy can be a powerful tool, not just for patients, but caregivers too. And there are community resources like the Cancer Support Community of East Tennessee and Breast Connect, offering everything from support groups to survivor events. Now cancer-free, Rachel says this experience tested her, but also revealed her inner strength. She's sharing her story to help others, especially young moms, navigating this difficult journey. This Breast Cancer Awareness Month, we celebrate survivors, but we also remember people still in the fight and those we have lost.
It's not fair to those that don't make it through or are living with like metastatic breast cancer or something like that, because they don't get that title, but they have fought just as hard and just as courageously. And so it's like a little bit of a good and bad. I think it's like good to honor those that have made it through the fight and to celebrate, but we also have to honor and care for those that are still fighting or that didn't make it through.
I guess I would just encourage people to keep going. Find your community.
And you can read more about Rachel's journey, plus support and services available in East Tennessee right now at WBIR.com. Now, we mentioned earlier Breast Connect, and that nonprofit, it got its start back in 2014 when a group of breast cancer survivors and patients teamed up. It grew as more women were diagnosed and found comfort and support with those who've been through those same difficult diagnoses. Well, now, especially as more young women are diagnosed, the organization hosts plenty of activities, including pickleball tournaments to raise awareness and funds.
Our goal is simple, is that no one faces cancer alone, that they've got somebody to walk with them along this journey, and not just anybody to walk with them, but somebody who's been there, who's walked this path before.
Breast Connect hosted the tournament over the weekend. More than 100 players turned out. If you would like to get involved with Breast Connect, they have a Facebook group you can join. They also provide free chemo and radiation packages and flowers to those having surgery. You can read more right now at WBIR.com. There are plenty of ways you can support the nonprofit Breast Connect this month, from happy hours to concerts, tailgating, and chances to dine out for a cause. We have a link to those fundraisers and the other events groups have planned during this Breast Cancer Awareness Month right now at WBIR.com. In this month of digital and day of digital and artificial intelligence, some are finding it easier to open up an app to share rather than speaking face-to-face with a therapist. But as 10 News reporter Emily Crabtree explains, be careful before you turn to AI to coach you through life's challenges.
AI is starting to have a hand in many areas of life, including therapy.
Everybody has access to AI right now. It kind of comes, with your computers, with your phone. And a trend we've been seeing is that a lot of people are utilizing AI to look up like mental health issues. And some have even made the choice to ask AI, what would I do for depression? What would I do for anxiety?
Dr. Julius Jeffries is a therapist and mental health specialist. He says that people who are using AI for their mental health could be causing more harm than good, and they're missing out on a human connection that therapists can provide.
AI doesn't ask follow-up questions in a manner that's indicative of like human intuition, compassion, kindness. It's more of like a data algorithm. And the thing is, we don't know where all that information even comes from.
Jeffries says building a relationship with a therapist can be a long process, but by building that relationship, you'll get responses specifically for you from a professional.
With us as human beings, we look for that nuance, that verbiage in your tone, the lack of eye contact. Do you really mean that, or are you just telling me what you want me to hear? Hey, you seem really nervous right now. Is today a good time to work on that trauma? And things like that.
Jeffrey says it's important to remember that AI gives answers that aren't always accurate, and that there are real people that you can turn to for help.
It's normal to have mental health issues. And also, it's a community affair to manage your mental health. It was never meant for you to manage alone.
Instagram is rolling out new safety features for teenagers who use AI chatbots on that app. It allows parents to block their teens from having conversations with certain characters, and it sends parents chat summaries. Instagram also restricts chatbot conversations on issues such as self-harm, eating disorders, and sexual topics. If you or a loved one are in need of help, we have a list of resources right now at WBIR.com. You can also text health to 865-637-1010, and we will send you a link to that online article. It can be hard for many to open up when they are struggling with their mental health, but a Knoxville hotline is working to make it easier and provide human interaction. We'll have more on the contact care line and how a simple call can make a difference coming up after the break. And then on 10 News at 6, a local nonprofit announced its new leader today. Hear from the president and CEO of the United Way of Greater Knoxville and her goals for the future.
Gen News on WBIR starts now.
Discussing your mental health struggles, that can be hard, but an organization tied to the National Suicide Hotline wants you to know that they are there to listen. 10 News reporter Emily Crabtree spoke with a therapist about the contact care line and how it's helping people with their mental health before a crisis happens.
When someone is struggling with mental health, it can feel like there's no one to turn to. But therapists in the area want people to know that they have options.
The contact care line is a 24/7 hotline that's associated with the 988 number, and it's been serving Knoxville for a number of years now.
The contact care line is connected with 988 to provide mental health services even if someone isn't in crisis.
Us therapists utilize 988 and the contact care line, and likewise, they will refer to us, if they say, hey, this person needs some services and things like that.
The hotline acts as a way for people to get help whether they don't have a therapist or they're in between therapy sessions.
If you need to talk to a therapist to process something, they actually have therapists that they hire, but also that volunteer so that you can talk to them.
Therapists say the hotline isn't just for those in crisis. They say it also serves to stop a crisis before it even starts.
Let's say that you're at like a 3 and the scale is 1 to 5, with 5 being the worst. You want to reach out when you're starting to feel a bit overwhelmed, because by the time you get to a 5, you may need a higher level of care. You may need a more support system.
And that no matter what you're going through, you're never really alone.
Mental health is not the absence of having issues. Mental health is the ability to manage issues as they come. And so the contact care line is definitely something that all of us need to be aware of, because you never have to feel like you're alone.
If you or someone you know want to reach out to the crisis care line, call 988. They will connect you with the professional. Again, you can find a full list of resources all across East Tennessee on our website, WBIR.com. From the Mental Health Association of East Tennessee to the McNabb Center, just scan that QR code. It will take you to that list. And thank you for watching. 10 News at 6 is next.